There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: why do people take blood pressure medication instead of simply eliminating salt from the diet? Answer by Zain Hakim. Lots of good answers here. I agree with many of the comments, but I want to focus on something that is usually missed by healthcare professionals and patients. Why do you want to lower your blood pressure? The answer, I hope, is because high blood pressure seems to increase the risk of heart disease and strokes and death, and you want to avoid that. If that is the root reason for wanting to lower your blood pressure, then it is important to choose a method that is in accordance with that goal. Salt reduction may or may not be a good method, because reducing salt only helps certain groups of people. Popular interpretation of the study by Science Daily here. Another example of this is cholesterol. Lowering cholesterol isn't important in itself, but only insofar as it advances the goal of reducing mortality. So if you take a drug that lowers cholesterol but doesn't change mortality, you're just wasting time, right, money, and taking the risk of having a bad reaction, all for no reason except that your blood work numbers will look better, which has nothing to do with anything. By the way, the data is anything but clear even on something as commonly used as statins. Getting back to the salt/BP question, the recent study seems to clarify previous conflicting results by indicating that if you have high blood pressure and you take in more than 6 grams of sodium per day, then you would benefit from taking in less salt. If, on the other hand, you take in less than 3 grams of salt per day, this study, same link as above, indicates that you may actually increase your cardiovascular risk and mortality, the opposite of what you want, regardless of whether you have high blood pressure or not. I want to repeat that. The study indicates that even if you have high blood pressure, taking in less than 3 grams of sodium per day can increase your statistical risk of cardiovascular events and mortality. Here's the interesting part. That study might be wrong. Studies often are, although this study uses urinary sodium excretion, the gold standard, so in my opinion, it trumps most other studies, especially anything using a survey. But at the very least, you can say that the matter is unclear. What is more clear is the benefits of blood pressure medications. In patients with non-trivial blood pressure elevations, it's actually a bit doubtful in patients with only mild elevations of blood pressure. I use JNC 8 guidelines for diagnosis, although they are controversial, partly because they recommend higher levels, which seems to fit other analysis. Drug companies want lower-level definitions to get more people to take their medications. So, the difference there is that if you have high blood pressure, then taking a blood pressure medication, like a thiazide or an ACE inhibitor, seems to actually reduce your mortality, especially from heart attack and stroke, even in the elderly, which is the real goal, as long as you set reasonable targets. Answer by Jenna Miles. Because for many people, simply eliminating salt from the diet is insufficient to lower their blood pressure to safe levels. There are many different factors that contribute to or exacerbate high blood pressure. Aside from a high added sodium intake, and salt is made up of both sodium and chloride, these include a person's weight and genetics. For many people, until they can achieve a healthy body weight, cutting added sodium out of their diet, i.e., from salt as well as from processed foods, will be insufficient to lower their blood pressure to safe levels. In the meantime, they need to take blood pressure medication in order to prevent the terrible complications of high blood pressure, including kidney failure and stroke. This is just one among many complex reasons why a patient may choose to take blood pressure medication instead of simply eliminating salt from their diet. I provide nutrition counseling to people living with HIV and AIDS. Many of my clients live with tremendous amounts of pressure and stress in their lives. A large percentage of them suffer from mental illnesses of varying degrees. Imagine if you had an unfortunately highly stigmatizing diagnosis like HIV. You might suffer from rejection and alienation from family and friends, as many of my clients do. You might feel depressed, too. You might suffer from chronic unemployment. You might suffer from severe food insecurity. You might feel, as many of my clients do, a bit overwhelmed at the prospect of a sudden and complete lifestyle overhaul, which is what is required to eliminate added sodium from the diet. So your doctor might prescribe a blood pressure medication. You know, so you don't die until you can make those incremental lifestyle changes that you need to make. Because compassion. Answer by Mark Wanda Wettering. Are you my doctor? If not, then why do you think that anyone should be using you as a source of medical advice? Studies show that reducing your salt intake probably will result in lowering of your systolic BP by about 5 points. For many people who suffer from hypertension, that is simply not enough to lower the risk of adverse consequences to normal levels, and treatment with drugs like hydrochlorothiazide are often safe and effective. There have been some interesting studies performed that also question the conclusion that salt is tied to hypertension and poor health outcomes, fatal and non-fatal outcomes, incidence of hypertension, and blood pressure changes in relation to urinary sodium excretion. Understanding the sources of salt in your diet can be helpful to lower salt intake, but having your blood pressure checked regularly and taking your doctor's advice is probably also a good idea. http://www.cdc.gov/salt/pdfs/su